The emergency room, if you've been in it, you know that it's not your first option. You shouldn't make that your first option. It's a lot more of a hassle. And if you do have a primary care physician who's there to help you out when in your time of need, go to him first.
Anything else that's not really the sickle cell, I can give that to one doctor and let him handle that. He doesn't have to worry about anything dealing with hematology, anything having to do with my sickle cell. He can just focus on my everyday pains, my everyday aches, everyday problems.
There are primary care physicians out there that know how to treat sickle cell patients, and there's some who may not know how to, but who might be willing to learn. And so you could ask them, would you be willing to take me on as a patient and work closely with my hematologist to learn how to properly care for me?
Yeah, I feel like a lot of people don't realize that seeing a doctor when you're not sick is just as important as seeing a doctor when you are sick.
A lot of our patients tend to stray away from primary care because they feel like sickle cell is a majority of what they deal with on a daily basis as far as chronic disease state.
The medical system is just very, very complicated, and navigating the various levels of the medical system can be difficult.
You all are busy, and it's hard seeing two doctors when you think one doctor can do it all. But I've spent the last 10 years learning how to take care of people with sickle cell disease the best. And that means that some of the other things that I used to do, sewing up people that had cuts, taking care of sprained ankles, I haven't been doing much of that. Get out of practice. So I think that you really need to have two doctors to get the best care.
Two is a better one. You know, if they can become like a team, they can also help you find out what's going on with you, help, prescribe medicine. And if there's two people battling it out, you know that when they finally do come down to consensus, it's going to be the right one because they both had time to sit down and talk about both of your different needs that you presented to each doctor.
Your hematologist really is to take care of your sickle cell disease, the problems you have from your sickle cell disease. And that's their focus, that's my focus. Your primary care doctor takes care of your general health. That might be managing your high blood pressure or diabetes, taking care of your sprained ankle, your sore throat. One doctor can't do everything.
A primary care physician can help them coordinate their care. Basically, when they see specialists, they're seeing specialists who deal with one's organ system and deals with one issue at hand, but doesn't necessarily look at the patient as a whole picture.
The hematologist that we have, he's just there for blood. He's just there for sickle cell. That's what he does. The primary care doctor he's there for everything else. So like, say if you are in pain, but it's not a sickle cell related pain, he's there to run those tests, see if it's whatever else it could be, your little bumps and bruises along the way, if it's a cold, anything else like that, he's there for you.
Yeah, you can separate the two, so you won't have one doctor struggling to keep up with your regular problems, your everyday problems, and then mixing that with the hematology problems, sickle cell problems. You can set them off so I can call this doctor for primary care, I can call this doctor for hematology.
Sickle cell, like I said, is just one factor of a person. You can have a cold and your hematologist may not know how to actually deal with that cold because she's focused on mainly just your sickle cell.
If you're seeing a specialist in one area, then that means they focus just on that area. So if I'm seeing a hematologist and I'm having problems with my vision, then the hematologist really can't help me with that. Whereas an internist is able to say to me, a primary care physician is able to direct me into all the different directions that I need to go in.
A primary care doctor is like the main route to your health.
You got to build a relationship yourself. It's not going to happen off the back. But as far as if she gets to know you, you get to know her, then you feel more open and you're able to do more or say more to your doctor. So it's both. It takes both of you to build that relationship.
The first one, he didn't know anything about sickle cell, which was kind of hard to work with him. The second one, she just wasn't good. I mean, she didn't even know about other things regardless of sickle cell. The third one made it to us that he wasn't comfortable treating person with sickle cell, so we left a handful of them, but I finally got one that worked for me.
Yeah, we're knowledgeable in it. We know, not claiming to be hematologists, not claiming to be sickle cell experts, but do have an understanding of the basic understanding of the illness and particularly flares and how to manage them.
And trying on a new doctor is like, a pair of shoes. You might try on a pair and you're right. You may not like that pair. It might not fit very well. So you might need to try another one until you find the right fit. But if you find the right fit and you're able to keep that person for years and years, it's worth the 2 or 3 that you may go through to get to the right person.
We now have a coordinator whose job is to help people find a primary care doctor. She'll try to find a doctor that's close to you, and we're working hard to train those doctors so they know how to take care of people with sickle cell disease with all the state-of-the-art knowledge that we have, and to work with us.
So we offer the range from acute care to total preventive care, and we see the patients from basically the entire lifespan, so from infancy to grave. The site itself offers acute care, so walk-ins, we can accommodate if you hurt your ankle, if you hurt your knee and you need to be seen, you can get an x-ray and have that treated, splinted, and we can get you to appropriate orthopedics evaluations if necessary, and you don't have to sit in the ER all day. Like I said, we do pediatrics, so we do all the screening things, we do hearing, we do vision, we take care of all acute care. We have extended hours or so for parents who need anything from, here's an ear infection to I need a physical. You can get it done after hours. We do wound care here. We do Coumadin checks here. Lab work is available. We have pharmacy here. We have patient services, who helps with the financial aspects of medical care, because we deal with people who are underserved and who don't have health insurance or may be underinsured. So they're helpful there. We have social work here. We have mental health. You're the focus of the visit, and so our goal is to get you in quickly because we know that you have other things to do, address your concerns, and understandably address your concerns in the time allotted.
Most of you have been to the emergency department for something, and you know that there's often a long wait. They prioritize people, so if you go into the emergency department with a rash, you might be at the bottom of the list, and if someone comes in and they're bleeding to death or they're having a heart attack, they jump to the front of the lines. And with your primary care doctor, most of the practices have open scheduling where you can get an appointment in the next day or 2.
All providers here have same day appointments, so if a patient needs to be seen, we get them in, and if there's some unforeseen reason that the schedule doesn't accommodate, the staff just asks the provider, explain the situation, and we work them into the schedule for the day. But we always have same day appointments.
If expense is an issue because of a lack of insurance, some of the primary care sites offer a sliding scale.
Say don't not go just because you don't have insurance. And what they may be able to direct you to, or what you may pay on a sliding fee scale, is probably a lot cheaper than if you don't have insurance and you go to the emergency room and you have to pay that fee.
I think in the long term, investing in your health results in better health and less time spent on health care.
Once you become their patient, they care about you or theirs. They care about you. And whatever it is that they can do to help you with, they can help you with it.
A person who knows you, so who knows your medical history, who knows what medications you're taking, and may have known that if you're coming in for an acute issue, is this an indication that this is something going on because you keep coming back? They kind of know you from that standpoint of not just seeing you at one point in time, but kind of looking at a person over a longitudinal time.
She was able to assist with me being admitted in the paperwork process instead of me having to wait. She even called me afterwards just to make sure that I was doing okay. So she does follow up phone calls, and other than me having to come in all the time, she'll call me every so often just to see, if everything's okay with me, if I needed anything.
It's another head thinking about your problems. So someone maybe with some different experience and different expertise.
But if they're willing to listen and learn about sickle cell, then I say give them that chance.
I just want to be clear that our intentions really just are to help and keep you as healthy, as long as possible.
Keep a smile on your face, you'll live longer. And them doctors, them primary care doctors, they keeps a smile on your face because they let you know that they care about you. And that's the best thing in the world, is to have somebody to care about you.